Great. And now we'll move on to agenda item 27, delaying implementation of Senate Bill 43 in Los Angeles County, which was held by Supervisor Barger. For members of the public on the telephone, please press 1 then 0 now to comment on this item. I believe Dr. Wong from our Department of Mental Health is available, Dr. Galley from DHS, Dr. Tsai, our Director of Substance Abuse Prevention and Control from the Department of Public Health, are all available if we have questions. I believe Supervisor Barger does have a few, so we'll give them time to take their seats, and I'll turn it over to you, Supervisor Barger.
Thank you, and thank you all. I know it's late in the afternoon, so I'll make this quick. Dr. Wong, could you briefly discuss the county's history supporting the grave disability reform and other stakeholder groups like NAMI who have supported it?
We've had a history of supporting LPS reform, and the last time there have been changes, substantive changes to LPS was about 60 years ago. So we know that there is a need for caring for the most vulnerable in our county, and I know that our partners at NAMI, many of whom are parents of people who are living with serious mental illness, are also looking for some relief in terms of LPS criteria.
And then to both you and DPH, I appreciate the report your department compiled outlining the challenges and changes in investments the county must take to appropriately implement SB 43. Could you each briefly walk through what these changes are for us so that we most effectively implement this law when it needs to be changed?
Sure. Do you want to go first, Dr. Tsai, or do you want me to? You can start with substance use.
Sure. So one of the expanded components of redefining grave disability under Senate Bill 43 is the inclusion of severe substance use disorders. And we have a lot of work that we have to do around that, given the fact that there is no model for involuntary SUD care. While there are drug courts today, drug courts are technically considered voluntary. And so from the licensure of facilities, for example, in California, there are no LPS designated specialty substance use treatment facilities. And so we would need to explore if there's going to be new certifications for that, how we would build that capacity within Los Angeles County. From a training perspective, our workforce on the specialty substance use side is also, because there is no involuntary SUD care, unfamiliar with just general LPS laws, 5150s, 5250s. Those are all aspects of training that will be important for us. And then working with DMH around ensuring appropriate care for people with co-occurring conditions. The other thing that I would just highlight is also the importance of implementing this expanded grave disability thoughtfully. We do have some significant concerns about driving people who use drugs and people with substance use disorders further into the shadows if it turns out that a lot of people are being placed on holds inappropriately, or that it's being done in a way that's not consistent with equity. And so I think that those are some really critical considerations that we'll need to approach thoughtfully as we move forward with implementation.
Does the state do the certification or does the county certify facilities?
The state does the.
Okay, so I would think that that's not going to be insurmountable. But having said that, I do appreciate what you're saying regarding pushing them into the shadows. In terms of those that have substance abuse problem. But my impression was that there was a checks and balance in terms of you just can't put someone into the system. There are safeguards to ensure that it's not used as a weapon or weaponized.
Those are some of the details I think we need to sort through with implementation, because the definition of severe substance use disorder is actually fairly broad in the way that it's defined in the bill. And so I think there are some operational considerations to that.
Yeah. And we've seen already amongst the different law enforcement partners that we have, there's already very varied interpretations of what comprises a very serious substance use disorder. So I think one of the major tasks that we have before us is coming to an agreed upon very clear definition of what grave disability is going to be. So there needs to be agreement between behavioral health, including, our partners at ZAPSI, and the Office of the Public Guardian, as well as other entities like hospitals, our law enforcement partners, because, it would be a very chaotic system if, let's say somebody used one criteria to 5150 somebody, and then the person at the hospital is evaluating by a different criteria, and then they come up for conservatorship and the OPG has a different criteria. So we have to get those in alignment.
And I appreciate, and that's a good lead into the question for you, Dr. Galley, but I would argue that even under the definition of gravely disabled now, danger to self or others, when you want a 5150 someone, different agencies will interpret that based on access to beds. And if they truly are a danger to themselves, they'll take them in. But if they feel that just drop them at a shelter or something, they'll be okay, because they know that if they try to find a bed, it's going to take 8 hours. They might interpret it. I mean, so because I've talked to agencies, and each one will loosen the criteria if it's based on resources. But having said that, I recognize that an increase in conservatorships will lead to more patients being put on hold in our hospital beds, both our county hospitals and our private hospitals. And many of our private hospitals we've talked about transfer them to the county once they stabilize them. And so can you speak to the expected impact and how a delayed implementation will help us better prepare to serve these patients?
Thank you, Supervisor. I think the delay would allow opportunity to do really two key things, and one is what Dr. Tsai and Dr. Wong were just referring to, which is clarity and clarification of what the criteria mean, and trying to provide some real-life examples and case studies so that those criteria can be applied as consistently as possible between sites. I think you're right that different hospitals and sites and clinics tend to have different temperaments and personalities when they're applying the criteria based on a variety of factors. And it would be nice to try to get clarity about what does it mean to have a serious substance use disorder? What does it mean to not be able to provide for your medical care? What does it mean to not be able to ensure your personal safety? And to have some real life examples so that the clinicians have some guidelines to go with. And then the second thing that the delay will be able to do, hopefully, is to be able to build up that treatment capacity that's so desperately needed within the community. Dr. Tsai mentioned this, but there's a lack of substance use only treatment beds, time to build those up, and then time, just as the county has already been doing, but putting an emphasis into building up the subacute mental health resources that are needed, because what hospitals, public and private, will be experiencing is more and more patients being brought in, potentially meeting criteria for a hold, and then having a decision point where the patient potentially needs to be admitted for longer term evaluation, but there's no bed available, and there's no bed available because there's so many patients that are backed up in the system because they're unable to get into a subacute placement. So the county's emphasis, rightly so, on building up those subacute beds is really desperately needed so that we don't back up all those patients in the ER or inappropriately discharge.
So the request is across the board. It's not just mental health. It's health has concerns, public health has concerns about our ability to implement this. I want to thank the state for passing the landmark legislation. Clearly, as I've said, 20 years ago, you couldn't get anyone to even discuss, even talking about reform LPS. And now it is front and center in terms of what needs to be done. And this is something I've advocated for many years, even before I was elected to office. If you spend any time with family members and those suffering from severe mental illness, it is evident that the existing law governing mental health care has been inadequate, ensuring necessary care is available to all that need it. It is in the spirit that 5 years ago I authored a motion to initiate the county sponsorship of legislation to change the LPS Short Act, an effort this county was strongly behind. We also recognize that expanding bed capacity is essential to this, which is why I'm glad that the state has submitted an IMD waiver application to begin the process of removing restrictions on our mental health bed expansion. This board has taken a position in support of applying for an IMD waiver, and I will bring in a motion at the first board meeting in 2024 to support the state's IMD waiver application. because I think it's important for us now to advocate back in Washington, because I know that there is some pushback in terms of concerns, but I would argue that we can show cost neutrality. When you look at the number of visits and the revolving door we've got going, and the fact that many people end up on our streets, and with this IMD waiver will allow us to actually, as I think you talked about, Solis, not only inpatient, but beyond the hospital, and making sure that we provide holistic services across the board, first and foremost housing. The county knows how desperately need this legislative change, and we hear directly from our constituents how urgent the mental health crisis is across our communities. Based on the feedback from departments, it is clear that there is uncertainty, and I understand that, on how long it will take to appropriately be ready for the county systems for the change to grave disability. Um, I'm trying to reconcile the San Francisco and San Luis Obispo, and I understand why San Luis, the author, represents San Luis Obispo. San Francisco says that they'll be ready to begin. And I was under the impression that the bed capacity is not unique to LA County. And so I guess my last question would be, what is the downside of saying we're going to go forward with the intention we're going to start? And if we can't, we can't. But by delaying 2 years, are we, I don't want to say kicking the can, but what is the downside to beginning to slowly, progressively bring it on board?
I think the downside potentially is that we have an very impacted system already. So if we further bring in this expanded population, it's going to cause even more of a bottleneck. And what I think would be heartbreaking for any of us to see is those who are like the highest acuity people waiting for a bed now, who will then have more people competing for that same number of beds. I think none of us want to see this put off in terms of being able to help our highest acuity folks, but we want to go about it in the most, I think, responsible, thoughtful way possible. And I think that's also why, this legislation has the language built in to allow for 2026, because it's such a huge landmark change in grave disability interpretation that it's going to take some time to get everything to a point where we can implement, I think, safely and effectively.
And I don't know if this would be you, and then I'll turn it over to my colleagues, but I know that, I think, Cecily, she brought in the motion to contract for 500 beds, mental health beds. Was it 500? And I know that we are looking at contracting for beds like in the San Gabriel Valley with Charter Oaks. Um, what is our ability to contract? I mean, where are we on the 500 beds? Because I feel like we're contracting, we're competing for the same beds. And now we are going to be looking at increasing for this population. And I'm just wondering how we're doing on that, and is there capacity in the community?
I think the capacity in the community is always a challenge, especially because there are some communities who don't want to have these kinds of facilities, in their surrounds. There is room, though, to expand where we already have a footprint, and we also are speaking to new providers all the time about, well, what would it take for you to be able to stand up more? Like, for instance, just from June 2022 until October this year, we've added over 800 beds to, our beds in DMH. So we have a plan going forward, a timeline for when additional beds will be added. We also have funding that's coming in at regular intervals to pay for some of those additional beds. But it's not going to be in time to implement in, next year or even 2025. I think a lot of our funding is going to mean that our additional beds, some of them, especially for those high acuity spots, will be in 2026 and further beyond that.
So beyond hospitalization, average length of stay, and then where do we place them once we stabilize them? And then I yield to my colleagues.
Average length of stay is variable because it just depends on the individual situations. We have our crisis residential treatment programs that can take people coming out of hospitalization who aren't quite stable yet up to about 30 days. They can be extended a little bit beyond that. A lot of it is, I think, dictated by availability, unfortunately, and by, as you mentioned before, temperament. So to say what somebody truly needs, I think that people truly do need more care in that in-between space between acute care and being on their own. And I think that's really the challenge for us to build that out and have the service capacity to back that up.
Supervisor Hahn.
Thank you, Madam Chair. I understand that expanding the definition of the gravely disabled to increase the number of people who will be eligible for conservatorship is the point of this legislation. And I realize that presents a heavy lift to everyone to implement it. But I think I share those who were behind this, that it does have the potential to save lives. And I know you all agree with that as well. And I sit here today and am worried about the consequences of delaying this for 2 years. These people are facing severe mental illness, severe substance use addiction, and who are on our streets and are unable to take care of themselves. And I'm not sure they're going to survive for 2 years. So let me just ask some questions. Dr. Tsai. So one of the things I was thinking about, because a couple of stories have come out, been hearing about it recently, that fentanyl is now becoming the leading cause of drug overdoses in LA County. Some of these people are in our jails, but many of them are on our streets. And the overall number of overdoses has increased every year for the last 7 years. In 2022, we lost over 3,200 LA County residents to drug overdoses. And I hear your concerns. I hear everyone's thoughtfulness about not wanting to implement this too soon. But don't we need to weigh that against the consequences of delaying this and continuing? I'm just going to call it's a status quo. And I think that's what we're also hearing from the public, is they're like, whatever you're doing, it's not working. We're still seeing people on our streets severely challenged with mental illness and drug abuse. Are you concerned, Dr. Tsai, that waiting 2 years, we could lose lives?
We certainly feel the urgency around the ever increasing drug overdose deaths happening across the county. I think, and we certainly agree that the status quo is not acceptable. There are a number of new initiatives and approaches that we're taking to try to take a different approach to address this longstanding issue. One of them has been supported by the board recently in terms of better reaching the 95% motion, which focuses on how we construct a substance use system that's designed not just for the 5% of people with substance use disorders who are knocking on our treatment doors, but for the 95% of people who should be but aren't. And that involves doing more outreach. That involves creating settings that people want to participate in, services that people are interested in, and ultimately expanding capacity and access to services. I do think that Senate Bill 43 and involuntary substance use services can be an important component of that. I also think that it's important how we approach that. So from a clinical perspective, when someone's intoxicated, it's very easy to determine that they're unable to make reasonable health decisions. However, people can become sober relatively quickly, a matter of hours, kind of depending on the substance. And at that point, I think that the question that we'll have to work through in terms of Senate Bill 43 implementation is, when do we determine someone no longer can make reasonable health decisions, even if they're no longer intoxicated and clearly able to answer questions about where they would stay, how they would feed themselves, how they would clothe themselves. Those are just issues that we haven't dealt with, but I certainly recognize the balance in terms of wanting.
So the answer is no, you're not concerned that we're going to lose lives by delaying this 2 years.
I think that we do feel urgency and we are concerned about people who are unable to access services for whatever reason.
Right. Okay. Yeah, that's what I'm concerned about. And maybe just, um, I know, Dr. Wong, you were saying part of why you want to delay it is so that we can have a better sense of the definition and have consistency. But again, I would point to San Francisco. How are they going forward with this, with that specific thing, the definition? How are they able to do this?
This is something that San Francisco has, I think, been trying to implement for a while, so they've had a little bit more time with it, but also they've recognized that they don't have the appropriate treatment facilities or anything to start with, so they're not sure how they're going to handle this when it implements. And I think, San Francisco as a county behavioral health is actually only a city, and it's a very different scale than what we have here in Los Angeles County. And I think that for us, the implementation matters not just because of finding a common definition. It really is a common definition, the necessary training, and most importantly, the capacity building. We can certainly start in January and expand that definition and start having people 5150 for SUD only. But if we have only a finite number of beds at this point, that person being hospitalized for that purpose will not only perhaps not get the appropriate treatment, they will also take the bed of somebody else who could be higher acuity and also in danger of having an adverse outcome. And that's not what we want to
I
see.
kind of feel like whenever we implement this, we're going to have that problem because we all know we're never going to be able to have the capacity that we sort of need for all of our issues. So I kind of feel that's going to be an issue, and we're just going to all have to figure that out. I mean, I think sitting here, I'm feeling like, we declared a state of emergency in the county for those living on our streets. The city did the same thing. I feel like Care Court, some of these other things is in line with this idea that it's all hands on deck for these people on our streets who are severely challenged with mental illness and drug addiction. And we have to use every tool possible to help these people. And I know the law says that, we all have to implement it, right? Every county has to implement this, but the law allows us to delay it for 2 years. But even the governor, I think he issued a statement being disappointed in us and the counties that are not treating the situation with more urgency. And I will say, to the benefit of all of our county departments, it seems like when we give our county departments a deadline, they meet it. I mean, if it's 2 years, you're going to meet it. If it was 1 year, I'm pretty sure you were going to meet it. Care Court was a good example. We weren't really sure if we were going to be able to do it, but everybody came together and we met that deadline. And I think it's like if we give you 2 years, it'll be 2 years. If we only had given you 1 year, I feel like it would have been 1 year that you would have come together and figured out how to do this. I'm just not comfortable, colleagues. I haven't really spoken to the rest of you about this, but I'm not comfortable postponing it for 2 years. I just feel, and I know, it's not even feel, I know there are people on our streets who are not going to survive and maybe would have a chance if we implemented this sooner to help them get the treatment that they need. So I'm not going to be able to support this motion as it is. I wish there were another option on the table today, but 2 years, January of 2024 or 2 years, I think both of those are bad options for us, but so I can't support this one as it is. Thank you, Madam Chair.
Supervisor Mitchell?
Thank you very much, Madam Chair. I just have to say, with all due respect, I don't see this as a delay at all. Having been a member of the legislature, I know that there are times when any elected body sets an arbitrary date. In my office, we would call it a pull it out of you know where. Because they, in creating the policy change, arguably the most significant change to the Lanterman-Petraeus Short Act since it passed almost 60 years ago. This is huge and significant. You said in 20 years, it couldn't pass when I left the legislature 3 years ago. So this is a lot of movement in a very short period of time, and that's wonderful. I don't see it as a delay. I see it as our ability to plan for its success. So I wish that, the term delay hadn't been, I agree. I wish it had not been entered into our lexicon because I just don't see it as a delay. I see it as a way that we make absolutely certain that it's successful. At a recent public meeting with the health deputies, the health departments identified various operational issues that must be addressed before implementation. This is a pretty long list. Those issues include client flow, system mapping and system guidelines, designation and training, treatment and care planning, management of individuals ineligible for new criteria, court processes, adherence to court orders, community education and collaboration, staffing and budgetary issues, managed care plan coordination, and data collection of demographics on who's being conserved. And many of these issues were identified in the Barger-Hahn November 23rd written report as a result of your motion. And so my question to all three departments, or two departments that are present, three. Dr. Wong, the October 2023 motion by Barger and Hahn asked you to create a timeline to implement SB 43 and to report back biannually thereafter. Will those future reports include clear deliverables for each of the operational issues identified by the departments? And the reason I'm asking is, we can do these sweeping motions. We're going to close something, we're going to open something, we're going to start a new process. I would hope that we would also, and we as a board, are clear about the steps it takes, because we can then lean in on the accountability, the budget decisions, the policy decisions we may have to make to operationalize this sweeping motion. So will those future reports include clear deliverables for each of these operational issues identified by the departments and provide status updates on progress on any challenges that you may incur?
Yes, Supervisor, we're ready to do that. In fact, we have a 7-point implementation plan already with the timeline, because this was part of our process in figuring how long and what it would take to implement this. Because I think likewise, I don't see this as a delay. I see this as phases of implementation. And in fact, SB 43, it's only part of it that is subject to delay to 2026. The other part of it still implements January 2024.
And those parts include the hearsay rule changes, the requirement that counties consider like least restrictive alternatives, new DHCS data reporting requirements, and perhaps some more.
Yes.
So it's not the whole thing.
Yes.
But again, it gives us time to plan, in that we are the level of government that has to operationalize.
I think plan and take action, because we plan for, every step to have an action that will come with it. And we're happy to report back to the board about that.
I think the other piece that concerns me, you ask about licensing, and it was the state, and I had a kind of visceral response, knowing based on budget cuts over the years and staffing issues at state departments, the delay in the state licensing so many facilities over the years that I was there. And this is new. And so just because it's not us having to license, it's the state, didn't give me any higher level of confidence that they'll be able to do it super, super quick either. So again, I don't think it's a delay. I think this is an opportunity for us to be smart and strategic and increase the likelihood that the LA County experience of 10 million compared to any other county is a successful one. That's what I want to see happen. And so I'll be supporting today's motion so we can be thoughtful, strategic, and plan well. Thank you, Madam Chair.
Supervisor Barger.
Yeah, I just had a quick clarification. When I look at the motion and it says, I move the Board of Supervisors adopt the attached resolution delaying local implementation of Senate Bill 43. Is that a requirement that we have to submit to the state?
Yes, there has to be a resolution submitted by the board.
So this is the resolution. So because to Supervisor Mitchell's point, we are already planning and trying to implement but we have to build the capacity, correct? So delay sounds to me like we are saying we're not going to do anything and we need until 2025. But in fact, if, as we build capacity, you are going to start to roll out, correct?
Yes. We will
So I
start to
think
roll
delay
out
is
for-
not an accurate, because I will bet you if I go up to San Francisco, even though they're ahead, I will bet you that they have not will not have fully implemented this. And I bet you San Luis Obispo hasn't either.
Yeah.
So I'm just wondering, because I hear a commitment by everyone on this board and by you all to do it, but you want to do it right. And there are things we have to seek clarification on from a legal standpoint in terms of definition of on the substance abuse side. What did you say, doctor? You said we need to get a clarification so we're not conserving people and using that as a weapon, weaponizing the whole program, the care accord. So I don't know. I mean, I just don't feel like we're delaying. I mean, I'm really having a tough time with this because I'm as anxious as anyone to get this going. I mean, like yesterday, we've known about this problem for a long time. But I just don't want us to let our guard down. And then it concerned me when the governor chastised counties who were delaying, because I don't want to be one of those counties who's part of the problem. I know. I think we're strong on record for being a county that stands tall and recognizes, especially when it comes to the unhoused, that we need to address the substance abuse and the mental health. Otherwise, we're not going to address those that are languishing on our street. So that's all. I just wanted to get a clarification on that. Thank you.
Supervisor Hahn?
Thank you. So, yeah, I mean, I understand what everybody's saying, but just to be clear, we are delaying. I mean, that's the name of this motion. We're delaying implementation of SB 43. As Dr. Wong said, we have to submit something saying we are delaying. And just to be clear, the report back that Supervisor Barger and I requested came back with a date of 2025. So it was January 2025 in the report back, but you have since changed your mind and are urging us to delay it another year. And just to be clear, there sounds like there's going to be a lot of work done. You're not just standing still, but by doing this, we will not start accepting people under the new definition until January 2026.
Yes, that's correct.
Okay, just to be clear, everybody, this means we will be delaying accepting people under the newly defined gravely disabled until January of 2026. So there's work that's going to be done. I get that. And we're not standing still. But basically, we are delaying implementation of the state law that's asking us to begin accepting people who are gravely, the expanded definition. So I get it. And everybody, you know, we want to move forward. I think everyone knows all of our commitments to those who are struggling on our streets. But again, maybe if it was January 2025, I would vote for it, but I'm not in favor of delaying this until January 2026.
And I understand your concern, Supervisor. I think it's really, you know, a matter of what we think realistically we can do to do this responsibly. And out of the 58 counties in California, only 2 have opted to not delay at all. And so far, only 3 till 2025. All the rest have been so far till 2026.
Supervisor Hahn, are you done? Okay. Supervisor Solis?
I just want to say that, you know, I was one of the votes to say, let's go forward initially. But having heard from you all and knowing the reluctance that you all had back then, and we've had time to now settle in and figure out where these resources are going to have to be planned out, as well as how fast we can get beds up. And today, we just passed, you know, our restorative care. It's taken a long time even to secure funding for that. We're waiting for the state to do more. We're waiting for a lot of things. But it doesn't mean we're going to stop. Today's proof of that. And I know that everyone here is working on trying to do something to create beds, whether it's even in our own facilities, and I hate to even admit this, but even in the jail. We're doing that. We have to, because we have other factors that are pressing and pushing us in that direction because of lawsuits and what have you. So I get it, and I'm, fully supportive of what you all want to recommend. And the urgency is, it's here, it's before us. We are going to lose lives. I mean, we're losing them now, right? So I don't want to, I don't say that with any intent, malintent, but to say that we know that there's a problem and we want to address it as a board. So I'm willing to go this route and support this motion because I think I'm basing it on the experts and what you all are prepared and can be prepared to do, because we can't afford also to end up in court. And as my understanding is, this is a voluntary program. There's so many people also out there that think that, oh, I can just quickly, come out and say that this person is gravely disabled and has to be put under conservatorship. There's a whole process, and we still don't know what that looks like. So I think that's also going to be an issue with our courts and with our public defenders and everyone else that has a say-so here, as well as our community groups that some of whom may not even want us to do any of this. So I understand that. So thank you, Madam Chair. I support the motion.
Thank you. As the author of the motion, I have a few questions for our panel, and then I'll just offer my comments before we go to public comment. First, I understand other counties are delaying their implementation. How many are, and which ones are they?
Excuse me. So far, 45 counties have officially been approved by their boards to delay till 2026. 2 counties have been 2025, 2 counties have been no delay, and then the rest of the counties, the rest of the 58, are still going before their boards.
So, so there are, it sounds like an overwhelming majority of counties who are also recognizing that they might need the help that your departments are requesting. So this isn't uniquely a Los Angeles County request. And you said that part of what you would need this time for is alignment and understanding the implications of different definitions and what terminology you're using and how it would be applied. This alignment wasn't required by the law?
This alignment was required by the law previously, but with this change to the LPS definition, there would need to be a realignment.
Okay, so the law provided a definition, but it didn't provide for the alignment that you need to do.
And didn't provide for clarification. And I think that's why the law has built into it the potential to delay for, till 2026.
And it's my understanding that the state has, obviously, as we heard, been pressuring counties to implement as quickly as possible, and the implementation date is January 1st. So what would you need to do in 12 days in order to be fully ready to implement?
I don't live in an alternate universe.
Yeah, I mean, I just want to highlight that the implementation date as set by the state is in 12 days, and we've identified some of these challenges and, that I just don't think we're going to be able to overcome in that amount of time. But also, the state doesn't have policies in place for licensed locked substance use treatment beds, and yet this law requires those to be in place in order to fully implement. So how are the 2 counties that are going to implement on January 1st going to do that if the state law doesn't provide them to do the very thing that this law requires them to do?
They've had no clear answer about that.
Okay, so that leads me to why I decided to bring this forward. It is, I appreciate the sentiment around we're not delaying because we are taking action, and I'll get to that. But we are delaying because the implementation date is January 1st, and the state law doesn't even provide for the very thing that this law requires us to do. That kind of lack of clarity and that disconnect in levels of government is exactly what frustrates people when announcements like the ones that were made around this bill and expectations that were set with this bill cannot be fully realized on the ground. It is absolutely absurd that we would be asked to implement this by January 1st without the kind of support that we need in order to get it right. I know our hospitals and our healthcare partners have expressed overwhelming gratitude for this motion today because they have expressed they are not prepared. In a Care First county, our healthcare facilities are not prepared for the magnitude of what this response could look like. And I want to be very clear, this county taking action on a different timeline is not taking action. DHS this year alone, just off the top of my head, I was writing down notes, has authorized over 1,000 new ODR beds. DMH is moving forward on 3,000 plus new beds in the Alliance settlement and has accelerated the implementation of Care Court on an accelerated timeline. SAPSI, just in partnership with this board at our direction, has announced the Reaching the 95% initiative. And these are just a few of the things that this county has proactively done to address the issues that motivated the drafting of this legislation. There is no question that action is required, but if we don't build out the proper process and supports, what this really means, if we implement it on January 1st, is people are going to jail. And I don't believe we should be incarcerating our unhoused, incarcerating our impoverished, incarcerating people who are struggling with addiction, incarcerating people who are struggling with mental health crisis because we want to meet this arbitrary deadline. Delaying full implementation does not mean we are delaying action, but it could mean that we are delaying or avoiding entirely liability and increased incarceration because we're taking away people's civil rights. We do have to act swiftly, but I don't think one of the tools we should be using is our jails. And if our healthcare facilities are telling us that they're not ready, the jails are the backup. That's what's gonna happen, and that is the unfortunate reality. Things then fall to our law enforcement partners when people don't wanna deal with other stuff. And that puts them in a difficult situation too. So I very much believe that we need to delay implementation of Senate Bill 43 until we get it right, because we cannot afford the liability cases and the risk of civil rights violations and risk getting this wrong. And I don't believe that was the author's intention either. They want us to get it right, and we want to be partners with them in getting it right because we want to be providing care, but we don't want to be a jails county. That's why we have a Care First policy here. So with that, Executive Officer, please call the members of the public who have signed up to speak on this item.
Can you write the cover letter to the state when we send this up there?
I think just send this recording.
Will the following individuals please come forward? Carolina Valle, Emily Truong, and Vanessa Ramos. Please come forward and staff will assist you. As a final reminder for participants on the telephone, if you would like to address item 27, if you have not already done so, please press 1 and 0 now to be placed in the speaking queue. Moderator, will we have the first remote speaker, please?
Of course. Our first speaker is LaTanya Richard. Please go ahead.
Shard. I am a co-founder and associate director of Communities Voices. We are a peer-run nonprofit throughout California. I am also a certified Medi-Cal peer support specialist, certified domestic violence advocate, and certified sexual assault advocate, as well as a person who has been severely abused by the mental health care in California and the United States. With the hearsay portion of this bill, until last month, I would be put into involuntary commitment or conservatorship because my medical records show that I was bipolar and schizophrenic, even though I have never shown signs of any of that. For the last 20 years, I've been on hundreds of medications for mental health disease that I've never had, only to find out last month, after so much complaining and advocating for myself to get the correct mental health diagnosis, to see a neuropsychologist, I was diagnosed as ADHD, autistic, CPTSD, and
Thank you.
borderline
Your time has
personality
expired.
disorder.
Moderator, next speaker, please.
That was not a full minute.
Eva Garo, please go ahead.
Good afternoon, supervisors. I'm Eve Garrow, a policy analyst with the ACLU of Southern California. I respectfully ask for your aye vote on the motion to delay implementation of SB 43. The ACLU opposed SB 43, which expands eligibility for involuntary hospitalizations and conservatorships at the same time that voluntary mental health services and affordable housing are often so underfunded that they are not accessible or available. This year marks the 60th anniversary of the Community Mental Health Act, a policy that envisioned a different world in which people with disabilities would have access to the voluntary care and housing needed to live fully and equally in the community. In such a world, fewer people would deteriorate and be subjected to involuntary interventions. We urge you to delay implementation and invest in desperately needed voluntary resources, which can offset this law's anticipated strain on the involuntary system and help create the thriving community we all deserve. Thank you.
Thank you. Next speaker, please.
Next, we'll go to Adina Tesler. Please go ahead.
Good afternoon, Board of Supervisors. I'm here on behalf of the Hospital Association of Southern California, representing more than 170 hospitals across 6 counties. We are here to support taking the time to plan and prepare for a successful implementation of SB 43 by 2026. Hospitals fervently support the goals of SB 43 and are committed to working in partnership with the county and collaborating with the county, health providers, law enforcement, EMS, the court system, and all stakeholders necessary to successfully implement this law. However, we are deeply concerned that our current system is not prepared to support the influx of new patients meant to be served by this law, and our hospital emergency departments are not prepared to hold and care for these patients until we can identify appropriate treatment. We urge you to give our system time to do this successfully, and we look forward to working collaboratively with you. Thank you.
Thank you. Next speaker, please.
Next, we'll go to Janet Tennyson. Please go ahead.
Hello, my name is Janet Tennyson. I am the Senior Communications Manager at the California Black Health Network. I live in Los Angeles County. As a part of a large coalition, on September 11, 2023, CBHN sent a coalition letter to Governor Newsom asking him to veto SB 43. SB 43 significantly expands involuntary criteria by allowing individuals with health issues, including substance use and alcohol use disorder, to be detained and conserved. As a Black-led organization, we urge the Los Angeles supervisors to delay the implementation of SB 43 by following the footsteps of Sacramento and San Diego. We are grateful to learn that Supervisor Holly Mitchell and Mayor Bass are in support of delaying the implementation of SB 43, and we have no doubt that their colleagues, too, will follow suit. SB 43 will likely target unsheltered individuals.
Thank you. Your time has expired. Next speaker, please.
Next, we'll go to Hector Ramirez. Please go ahead.
Buenas tardes. My name is Hector Ramirez. I live in Chatsworth, and I am a consumer at Los Angeles County Department of Mental Health at the West Valley Mental Health Clinic. I have been receiving the services of the department for now almost 24 years. I really want to thank Supervisor Horvath for this motion and the supporting supervisors. As a consumer, I know right now that our staff, the department, are so overwhelmed. We have a significant shortage of staff in all capacities that not only is delaying the availability of services to potential candidates for care court, but the quality and the timely access of services currently right now for consumers like myself, it has been significantly disrupted. We know that there is a lack of disability accommodations. There's a lack of services for Latino, Hispanic students, individuals, and for queer people with substance use disorders are candidates for the Department of Mental Health, but for the longest time, you know, I know very well that they have not been welcome and treated horribly.
Thank you.
When trying to access
Your time
services.
has expired.
So
Next
I really
speaker, please.
hope we can develop this further so that better people can have better services. Thank you.
Thank you. Your time has expired. Next speaker, please.
Next, we'll go to Allison Burney. Please go ahead.
Hi, this is Allison Burney, and I am the clinical director at Huntington Hospital in Pasadena, California. I just wanted, from a clinical perspective, urging the supervisors to vote to delay. Our hospital emergency department is overrun with patients. Our trauma volume, as we're a level 2 trauma center, has gone up 44%. And holding these patients in our emergency department is not the best place for them to be when we cannot provide wraparound behavioral health services for them. Appreciate your support in delaying SB 43. Thank you.
Thank you. Next speaker, please.
And next we'll go to Salem Ullman. Please go ahead. Ullman, your line is open.
Salam Alem.
Yes, your line is open.
Sorry, I can't hear the speaker. Okay, we're going to go to in-person speakers. Go right ahead.
My name is Carolina Valle, and I'm the Senior Policy Director with the California Pan-Ethnic Health Network. We are a statewide multicultural policy advocacy organization, and we are here to voice our support for the delay of SB 43. We are part of a broader coalition of organizations that have been opposed to SB 43 and are supportive of Supervisor Horvath's motion. SB 43 would expand the universe of people who can be detained and conserved, and it could have potentially disastrous effects for people of color in Los Angeles should the logistical and equity considerations not be ironed out well in advance. We are urging the rest of the board to vote in support of the delay of SB 43. Thank you.
Thank you. Next speaker.
Hi, my name is Vanessa Ramos, and I work for Disability Rights California. I also serve on many councils, and it's so glad to see familiar faces here. I strongly urge the board to postpone the implementation of Senate Bill 43. Counties, including Los Angeles, lack the necessary behavioral health infrastructure for immediate enactment. There have been 56 counties seeking this delay. Los Angeles County faces a critical shortage, as mentioned, for specialized treatment facilities in bed, particularly for severe substance use disorders. Expanding this definition to include SUD population is 9 times larger than those with serious mental illness. Groups advocating for SB 43's immediate effect often focus solely on serious mental illness, lacking experience in severe SUD. Please consider the delay.
Thank you. Thank you. Next speaker, please.
Greeting Boards of Supervisors. My name is Emily Wu Truong, and I am a mental health advocate for the last 10 years as a consultant to LA County Department of Health, an active member of NAMI, the National Alliance on Mental Illness, facilitating support groups since 2016. And I also serve on the steering committee member as at the National Asian American Pacific Islander Empowerment Network, NAPIEN. Today, I speak to you as a person who advocates for myself and others who call themselves psychiatric survivors. The last time I was actually here in this room, I was honored for my grassroots mental health advocacy work on May 9th, 2017, with Barker, with Han, with Hilda Solis. And so I'm so happy to meet you, Supervisor Horvath, today. On July 29th, of this year, after calling 988, I was legally kidnapped by the Arcadia Fire Department without my consent and involuntarily hospitalized against my will by the Arcadia Police Department. The officer did not follow proper protocols with regards to the 5150 law.
Thank you for your comments today. Are there any other speakers?
No other speakers, Madam Chair.
Okay, then item 27 is before us. I will move it, seconded by Supervisor Mitchell, to approve the item. Executive Officer, please call the roll.
Item 27 is before you. Supervisor Solis.
Aye.
Supervisor Solis, aye. Supervisor Mitchell. Aye. Supervisor Mitchell, aye. Supervisor Hahn.
I'm going to vote no.
Supervisor Hahn, no. Supervisor Barger.
Horvath got me, yes.
Supervisor Barger, aye. Supervisor Horvath.
Aye.
Supervisor Horvath, aye. Motion carries 4-1.
I'm here to, in favor of agenda item 15 and 73. So I think I have 2 minutes at least.
That's right,
Yeah,
2
thank you
minutes.
so much. And so I also wanted to continue from what I said earlier about my 5150 from July 29th. The Arcadia PD said to this is how they informed me that I was 5150. They said, I'm sorry to have to do this to you, but do you know you're being 5150'd? And to me, that sounds like they're saying, surprise, you're in jail in the USC Arcadia Hospital for the next 72 hours, and you're not allowed to leave this place. I was never informed of my patient's rights at USC Arcadia Hospital, and I was treated terribly inside the ER and Kaiser Mental Health Center on College Street. My life turned upside down. I experienced a living nightmare for 50 hours. I literally felt like I was in a scene of a movie, but like One Flew Over the Cuckoo's Nest with Jack Nicholson, but there was no movie director to say, cut! I felt helpless. I felt hopeless. I come to you pleading for answers. I do not know how to navigate this system. I do not have disability. I have a terrible private healthcare insurance called Kaiser. To this day, I do not have a public defender nor patient's rights advocate to help me cope with this system failure. I am a minority of minorities, and I do not want this experience to happen to anyone else. I do not appreciate being involuntarily hospitalized and then financially burdened with bills that amount to over $3,300. And I know that my voice shakes, but RBG, I am wearing her t-shirt right now, and it says, fight for the cause that you believe in. And she also said, speak even though your voice shakes. And speak, and I have another t-shirt that says, take breaks, but stay woke. Do not let psychiatric survivors not go unprotected, just like the seniors in the elderly homes. We need your help, and there needs to be accountability. Thank you.
Thank you. If
Madam
you
Chair,
would
do you live in
like,
Arcadia? I mean, because I can have a.
Okay.
Are you an Arcadia resident?
Yes.
I'll have someone come out and we'll see if we can get you some help. Okay.
Thank you so much.
Thank you.
thank you, Supervisor.